I'm gonna knock on the door. I'm gonna introduce myself to Mom. I'm Kylie. I'm gonna be doing a baby assessment. Mom gives me permission. And then hand hygiene, privacy, if needed. I'm going to check the bands on baby's hand. We got baby Hutta, 1, 2, 3, 4. Checking mom. Mama's Hutta, 1, 2, 3, 4. And I'm gonna check the umbilical cord and the opposite foot because it also has a band. Make sure they're all matching. And then I'm gonna do lung sounds and heart rate. And I would use a neonatal, but we don't have one, so I'm gonna use the back side of the adult one. So I'm gonna auscultate for a minute. Respirations should be 30 to 60, and then heart rate should be 110 to 160. I'm watching the nose for flaring, and I'm seeing if there's any wheezing or grunting or retractions as I'm doing this. Everything looks good. We're going to cover baby with thermoregulation. This is going to be my thermometer. So I'm just going to stick it, make sure it's on the skin and the axillary. So we're going to listen to that, and while we're listening, we're going to inspect baby's eyes, make sure they're white with no jaundice. We're going to make sure that the canthus is equal with the ears to indicate no Down syndrome. We're going to assess the mouth and see if there's any eps and pearls, cleft palate, flaring of the nose. We're going to look at the baby's fontanelles and sutures, making sure there's no hematomas or bruising, or if there's an odd shape, we would note that, but we want to make sure that it's smooth and flat. Make sure that we get the occipital fontanelle and sutures. So everything with baby looks good. Okay, my temperature is 97.7. This could also double as my pen light to inspect the mouth for the eps and pearls. Okay, that looks all good. We're gonna lay baby down. We're gonna don gloves, which you could do prior to this. So we're gonna gently unswaddle baby, trying to keep her as warm as we can. So we're gonna auscultate one more time, checking for retractions, murmurs, just reassessing all four. We're gonna go from the clavicular to the 4th or 5th intercostals. Okay, and then we're also going to listen for the bowel sounds in all 4 quadrants, a minute, just like we did on the lungs and heart. Bowel sounds sound good. So we're going to cover baby, or unswaddle just a little bit. We're going to look at her integumentary system, but keeping her lower part warm. So we're going to check her arms and her head. We would assess that her head is movable. Nothing's wrong with that. Check her arms. We're going to check her capillary reflexes. Make sure there's 5 fingers on each hand. Making sure that their skin is all pink and clear. Her bowel sounds were good. We would ask mom when her last diaper change was. She said, oh, about 15-20 minutes ago. So there might be a little urine. So everything looks good. There's no pseudomenstruate. She is a little swollen due to mom's hormones, but everything looks good. Okay, we're gonna roll baby over, and we would, if she was poopy or dirty, we would change her gloves, but she's not. So we're gonna roll baby over. We're gonna check the alignment of the spine. We're gonna to see if there's any dimples or cluster of hair to indicate spina bifida. We're going to also check baby's gluteal folds, make sure there's symmetry, making sure that the pelvis is not out of line. So everything with baby looks good, and I would, if I can do this one-handed, not that gifted. So we're gonna auscultate on the back a minute. We would use smaller side. Checking for crackles like we did the front. Everything looks good. Okay, now we're gonna get baby back under blanket. And then when we're inspecting the umbilical cord, we want to assess for odor, discharge, anything that looks abnormal. It should be sort of drying, depending on how post baby is. Make sure when you do the diaper that it is below the umbilicus because it needs airflow to dry. Okay, so now we're going to cover up baby and assess her feet. And we're checking for 10 toes. We're going to check her refill, and I would have blanched the skin on her forehead to check for yellowness or potential jaundice. We're going to assess her movements. She looks good. Okay, and then if mom had any questions regarding assessment, we could answer those during this time. If she needed education on anything. Okay, and then we're gonna swaddle up baby. And then once I'm done swaddling and I return baby to mom, then I would document all my findings and report to the charge nurse that there is anything wrong.